Hello students, in this session we will discuss about the PYQs of community medicine from NEET PG 2021. So let's begin with the MCQ number 1. Which of the following thermometer is used to measure the low air velocity rather than the cooling power of the air? So here the right answer is Kata thermometer, because Kata thermometer used to measure low air velocity rather than the cooling power of the air. Previously, Kata thermometer was used for cooling power of the air, but nowadays it is used to measure the low air velocity. Next is there are some air temperature instruments are like dry bulb thermometer, then wet bulb thermometer, maximum thermometer, minimum thermometer, 6 maximum and minimum thermometer, and silvered thermometer. These are used to measure the air temperature. And few more thermometers are like globe thermometer is used to measure the mean radiant temperature, while wet globe thermometer is used to measure the environmental heat, and Kata thermometer is used to measure cooling power of the air and the low air velocity. So nowadays what is happening, it is used to measure the low air velocity rather than the cooling power of the air. Next is the next question is, there is an outbreak of bubonic plague in community. What is the vector responsible for the condition? It is very simple, easy question. The plague, the vector of the bubonic plague is, Xenopsila chiosis. So option number A is the correct answer. It is very easy question. Next is, after a road traffic accident, case is admitted and there is blood spillage on the hospital floor. So which disinfectant should be used? So if there is spillage of the blood on the floor, we should always use sodium hypochlorite, and even the housekeeping staff of the hospital is know about this. So housekeeping staff of the hospital usually term the sodium hypochlorite as a hypo, and there is a hazmat spill kit, which is hazardous material spill kit, is to be used by the housekeeping staff to clean the infective material from the floor, especially the blood or any infected material if it is on the floor on the hospital. Answer is the sodium hypochlorite. Next one is the, based on the air pollution data, air pollution index chart for 4 consecutive days at the Delhi station, how is the air quality index for November 23 classified? So here is the data of air quality index AQI on November 23. So AQI is is 350, 342 and 207. So when AQI is more than 400, it is considered the severe pollution category. Okay, so it is answer will be D. There is a there is a table to differentiate the different AQI. When AQI is under 50, it is considered the good. When it is between 51 to 100, it is satisfactory. When 100 to 200 is moderate air pollution, 200 to 300 poor, and the 300 to 400 is very poor, and 400 to 500 is severe air pollution. So you just remember these things, poor and very poor and the severe. Okay, see, a severe condition is after the 400 AQI. The next one is, during an outbreak of acute encephalitis in the community, a vaccination drive is initiated. Which of the following statements is true about the vaccine administered in the situation? So they are talking about the acute encephalitis. And acute encephalitis outbreak is usually talking about, they are talking about the Japanese encephalitis, and they are talking about the vaccination of the Japanese encephalitis. So initially we were thinking that Japanese encephalitis is a killed vaccine only, but nowadays there is live vaccine of Japanese encephalitis available in the national immunization schedule. And Japanese encephalitis in measles rubella campaign MR vaccine, both are given at the age of 9 months by subcutaneous route. So the vaccine is live, the route is subcutaneous. So answer I think will be B. Okay, so there are killed and live, both vaccines are available in Japanese encephalitis. During the outbreak, we usually give live vaccine. Why? Because live vaccine will initiate the immune response faster and early. Okay, and this vaccine is a live vaccine constructing using the yellow fever 17D and Japanese encephalitis SA1414 2 vaccine strain. Okay. Next one is a girl child has experienced recurrent yeast infection and respiratory virus infection since she was 3 months old. If a child who is only 3 months old is having recurrent yeast infection and respiratory virus infection, it means child is immunocompromised, or might child is having HIV status. The baby is born to the HIV mother. So which of the following vaccines should be avoided given her immune status? So in immunocompromised status, we should avoid the live vaccines. And what are the live vaccines? I told you the trick of live vaccine when I was teaching you vaccination. So you can see that MMR is a live vaccine directly here. So in his option MMR here, MMR is a live vaccine. It should be avoided in case of immunocompromised status. So answer will be B here. The next one is, a researcher is examining the association between CRP level and the risk of MI or stroke. The study group was divided into quantiles and the results are presented in the tables below. So we have to study the table which statement best reflect the relationship between CRP level and the risk. So what we are seeing that CRP level is 0.121 here, then the risk is 1. As the CRP level increase, risk increase. As the CRP increase more, the risk is more. And as the CRP level increase more, when it becomes to 3 to 4, risk is also increasing. It means the risk of MI is proportional to CRP level. The risk of MI, relative risk of MI is increasing in the level of CRP. This is our verdict by checking the tables. Now we are looking to the option. There is no association between CRP level and risk of MI. This is a wrong statement. Then higher CRP level are associated with an increased risk of MI stroke. This is correct statement. Then higher CRP level are associated with decreased MI. No, this is again wrong. Higher CRP, higher the risk. Quantile 1 show no risk of MI or stroke. No, quantile 1 what is saying that there is a relative risk of 1. Risk of 1 means there is equal chances. So we cannot show there is risk is no or yes. It is a neutral condition. So this is also a wrong option. So our answer will be B. Okay. The next is, a child with pharyngitis had a throat swab collected and sent for the culture. Okay. So a swab is made of cotton and it is having bacteria or virus, means microbiological agent. In which color bin should the used swab to be discarded? So when we study the biomedical waste management, for yellow bin we say that human waste, human anatomical waste, animal anatomical waste and microbiological anatomical waste or microbiological waste to be discarded in the yellow. Here cotton is a combustible material. We can do the incineration for the cotton, and the microbiological waste is also here. So we can go for the yellow. Now looking to the other option, red is for the infected tubings, plastic material, white and blue for the shafts. So answer will be B. The next one is, which of the following manages the school health program? So primary health centers are directly managing the school health program everywhere, because district hospital, sub-center, there is no doctor at the sub-center to manage the things, and sub-divisional hospital, these are the big thing. In district there might be 50 to 100 hospitals, or in the whole district program, in the whole district maybe 500 600 schools. So district and sub-district hospitals cannot manage the PSC. A primary health center can manage the school health program, because in a village, if there is a PSC, there might be 2 or 3 schools. Each PSC can manage the school health program. So answer will be, I think, A. Okay. The next one is, a man from MP, it means Madhya Pradesh, presents with progressive muscle weakness. Okay, as patient is coming from MP with progressive muscle weakness and leg spasms, the thing came in mind is just letharism, lethyrus sativus, and pure motor paresis is observed in the examination. What is the most relevant history to obtain from the patient? So what is the cause of letharism? Cause of letharism is the khesari dal. So we have to identify, we have to obtain the history of diet, we have to obtain the history of consumption of the khesari dal. So here history of diet will be our answer. Then answer will be B. So these are very simple questions have been asked in NEET PG 2021. In a 10-year-old school child, which of the following vaccine is administered as a part of immunization program? So in immunization program at the age of 10 years, what you have to given? So at birth we are giving BCG, OPV, hepatitis B. 6 week, 10 week, 14 week, hepatitis B is completed within the penta. At 9 month we are giving MMR. So MMR we are giving in 9 month. BCG we are giving at birth. DPT, now we are not giving DPT as well, but we are giving DPT in the penta only and at the 16 months only. So DPT will not be a part. So only TT or TD is remaining. But however, we know that at the age of 10 years we are giving tetanus vaccine. So answer will be C only. So this is the national immunization schedule we have already studied in the lecture. Next question is, an Anganwadi worker measures the weight and height of a child. If child's height is above, age is below the 2 SD, it means child is under the malnutrition. Okay, and which type of the malnutrition? So if a child is having height less than the normal child, it means we cannot say that height will reduce in 1 day or 2 day or in 5 day or 10 day. It means stunting. It is a part of stunting, and stunting is a chronic thing. So the child is having chronic malnutrition. So answer will be C, because there is no history of weight. So we cannot talk about the acute weight loss or acute infection. There will always be a history of weight loss in the acute infection, and in option there is no history. In question there is not talking about the weight loss, or they have not given anything about the weight. Answer will be C. A farmer came with skin rash in sun exposed part of the body around the neck, and his staple diet is the maize. So they are talking about in maize eating population. We know there is a disease pellagra due to deficiency of niacin. Why niacin? Because in maize there is deficiency of niacin, and maize is having leucine, which also reduce the conversion of tryptophan to niacin. We have studied it in the nutrition chapter as well. In a person around the neck there will be a Kessel's neck. So answer will be niacin. It is very easy question. Okay. Next one is a few person after eating pastries in night develop vomiting in the morning. So person might be having eating pastry in night around 8 p.m. to 10 p.m. and in morning 6 a.m. person is having vomiting. It means around after within 8 hours person is having vomiting. It means it is early food poisoning of 1 to 6 hours only, and it means it is a part of vomiting type food poisoning. So there are only two things that is responsible for the food poisoning in the early 6 or 8 hours. That is number one, Bacillus cereus emetic type, and the another is the Staphylococcus aureus. And Bacillus cereus is due to canned food, due to raw food, while Staphylococci from milk product. So pastries we can consider pastries in the milk product. Okay, pastries is having cream and all. So Staphylococci, I am going with the answer Staphylococci, which is our correct answer. Then next is a child presented with bluish white patch in the mouth followed by rash. Bluish white patch in the mouth followed by rash. So it means they are talking about which disease? Bluish white patch in the mouth is Koplik spot. Koplik spot. Okay, and this Koplik spot is seen in the measles only. So they are talking about the measles. So they are talking about the genome of the probable causative agent. So here I told you that measles is a enveloped virus, which is a single stranded RNA virus. So our answer will be A only. Okay. Now we will discuss about the some other enveloped virus also. The majority of viruses are the enveloped, until unless we know that some non-enveloped virus also, like parvovirus B19 and HPV are the non-enveloped virus, which are DNA virus. And in RNA virus, picorna virus, which is a hepatitis A virus, and polio virus and the rotavirus, they are the non-enveloped virus. So you remember these viruses only, that these viruses are the non-enveloped. So other all are the enveloped virus. Like in DNA virus, adeno, parvo, polyoma. Polyoma virus is similar to the papilloma virus. Both are bhai bahan. Okay. Then RNA virus is calcivirus, picona, rio, estro and hepaviridae, in which calci and the picona virus is important. Calcivirus we know where it was in the hepatitis E virus. Calcivirus in the hepatitis E virus, and the picona is the hepatitis A virus, and polio and the rotavirus. So you remember these name of 5-6 viruses, that they are non-enveloped. Remaining all are the enveloped viruses. Then next question, next MCQ. 16-month-old child, 8 kg weight. Okay. On growth chart, assessment falls between the standard and the -2 SD. So what should be the next management? So when we talk about the growth chart, there is the standard value, and if a child is coming between -2 SD and the +2 SD, child is considered the normal, and it means this child is in the normal stage. So we have to tell the mother, we have to tell the attendant that there is no malnutrition. You just assure the mother and do nothing. There is no mild malnutrition, no moderate, no severe. Okay. Then next one is the evaluation based on the treatment given to the patient and their clinical management in a healthcare facility measures which of the following. What is this question? It is very vague question talking about the evaluation. Okay, which is based on treatment given to the patient and the clinical management in healthcare facility. What is this? I am not clicking anything about after reading the question, so I am going towards the options. Number one is outcome. Outcome, what is outcome? Outcome is the either recovery or death. So we are not talking about the outcome here, because in question it is saying the treatment given to the patient and the clinical management. Now they are giving the treatment, they are managing the patient clinically, not talking about the outcome. Next is the process. So what is the process of a healthcare facility? When a patient come to us, we are diagnosing the patient, we are giving treatment, we are clinically managing the patient. This is the part of process. So here our question coincide with the option process. Outcome is totally wrong. Then third is the structure of the healthcare facility. So structure of healthcare facilities like infrastructure and buildings and the instruments and all. So it is not talking about the treatment given to the patient. And what is input? Input usually in the term of finances, in the term of man, machine and the money. Okay, so this is not the option. So I think process will be the best suitable option here. Answer is B. So you can solve the question. You should not afraid of the question. You should think about the options. You might get the answer. Next, which chemical will be distributed along with the doxycycline tablet for prophylaxis in the flood affected area? So if an area which is affected by flood, government is distributing doxycycline, okay, also distributing malathion, also distributing cypermethrin, also distributing sanitary napkins and some emergency drugs. So these things governments are distributing in the case of the flood. So now which option we are choosing? Zinc phosphide. Government cannot distribute zinc phosphide, it is too much dangerous to the human also. And malathion, it is also dangerous, but it is in the list. Okay, so I am going with the option number B. The answer is our correct. Then in a biomedical waste management, which bag should a culture plate to be disposed of? So what is culture plate? Culture plate is a plate of microbiological agents. Now culture plate is made of either plastic or of glass. So culture plate, we cannot incinerate the culture plate. We can incinerate the content of the culture plate. So if a question is asking about the content of the culture plate, it must be discarded to the yellow bag, because it is a microbiological waste. And previous question we have discussed that anatomical, human anatomical, animal anatomical and a microbiological waste to be discarded in the yellow bag. But it is if it is talking about the plate, so it should be discarded in the red bag. Okay, because it is infective plastic material, or if it is made of glass, in which box we should discard in the blue box. Now, blue for the glass material, cardboard box with the blue, what I can say, blue stickers. So it is question, this question is giving you three options, but for we in the question is not telling that the culture plate is of made of plastic or made of glass. So we cannot go with the red and the blue. So we have only one option remaining, because it might possible they are asking about the microbiological waste, which is to be discarded in the yellow bag. So answer will be C here. Then which of the following is a conditioning factor to malnutrition? What is conditioning factor? Conditioning factor means a factor who is conditioning the malnutrition. So child rearing practices cannot be conditioning practice, because child rearing practice is different to different person. Dietary habits is different to different person. Socio-economic status is different to different person. But infectious disease is not different to different person. Infectious disease will cause the malnutrition. How? Because this is a vicious cycle. One person is infected, he will or she will uh, have loss of appetite. Because of the loss of appetite, there will be malnutrition. If there will be malnutrition, there is further chance of infection. So this is a vicious cycle. Okay, while one more thing, child rearing practice, dietary habits, these are the cultural factors. Also socio-economic status, it also a economical factor. So only one option is remaining here, that conditioning factors could be the infectious disease. So our answer will be B here. Next is, which SI unit is used to measure the brightness of the light? So it is directly a direct answer, you have to remember it, lux, and we have discussed this about this in the environmental factor chapter also. The lux is the answer. Next is, a pregnant woman who lives with her nephew who contracted varicella tested negative for the serum antibodies against varicella. Tested negative means no antibodies for varicella. So what does it indicate? So option are, she is immune to shingles, she is susceptible to shingles, susceptible to chickenpox, and immune to chickenpox. So let me tell you, once a person is having infection with the chickenpox, person will develop the immunoglobulin against the chickenpox, means antibody against the chickenpox. After that, person may have infection of the shingles. So shingles will occur even only when person will having antibodies against the chickenpox. So here patient or person is negative for the serum antibodies, it means shingles, immunity or susceptibility, both are not in the option. He is not susceptible, she is not susceptible for the shingles and not immune to the shingles. Now there is no immunity against the chickenpox, no antibodies against the chickenpox, it means there is no immunity to the chickenpox. This option is also wrong. And if there is no immunity, if there is no antibody against the chickenpox, person is susceptible to the chickenpox. So answer will be C here. Okay, answer is C. Then the International Food Policy Research Institute calculates the Global Hunger Index GHI using several parameters. Given the following parameter: number one, proportion of the undernourished population, prevalence of underweight children, and mortality rate for children under 5 mortality, and the infant mortality rate. Which of these parameters is not used in the calculation of the Global Hunger Index? So it is a ratta question. You have to keep remember that GHI is calculated by using under 5 child mortality, under 5 mortality rate, then by child undernourishment and child underweight. Infant mortality rate is not a part of Global Hunger Index. Even infant cannot be considered as a part of Global Hunger Index, because till the age of 6 months, infant is exclusively breastfed by the mother, and next 6 months he infant is also taking some breastfeed from the mother also. So hunger index, infant mortality cannot be a part of the hunger index. So my answer, I am going with the answer A here. and this is our answer. Next is, a male is presented to OPD with complaint of white pus discharge from the penile urethra. So it is means they are talking about the urethritis. Okay, and we have two options when we study sexually transmitted disease, as we have studied in the communicable disease section, that urethritis, the cause of urethritis might be gonorrhea or chlamydia. These two are the options, gonorrhea or non-gonococcal urethritis, that is chlamydia. So here we are looking to the option Candida albicans, it cannot be, genitalis uriaticum cannot be, gonorrhea is the option, and Haemophilus ducreyi cannot be. So I am going with the gonorrhea. And if instead of gonorrhea, if we are having non-gonococcal urethritis or we are having chlamydia trachomatis in option, it will be the correct option. Okay, so I think this is all about the previous year question of community medicine from NEET PG 2021. I hope you understood the lecture well. Thank you.